And so in 4 minutes, we're just going to do one sort of rapid fire question for each case based on the number of questions that you asked. They were all so excellent. So the one that sort of was asked the most for each case, we'll briefly ask, and we will have you out of here on time. So for Rob, and unfortunately Dr. Lee is gone, but I think this is a great question for you anyway. For back to the optic pathway glioma question and neurofibromatosis, many patients, or many of you in the audience, wanted to hear about the use of OCT and RNFL for screening in optic pathway gliomas, and if that could influence a decision whether or not to do an MRI.
So I do not screen with OCT if you know, under the following circumstances. If I get a kid in, I can do a good visual exam, they can prove their acuity is normal, and I don't have any concerns on the dilated exam. If any of those factors are off, like you have a squirrely kid and they're not really getting age-based normative data, or you look at this nerve and it's really kind of hard to determine whether there's some pallor or other things, then I'll go on to OCT kind of as my tiebreaker. If I find that and I do see atrophy on OCT or convinced, then I might go on to an MRI. But for the run-of-the-mill NF kid that comes through, if I can prove everything's normal, I don't go on to OCT.
So for Dr. Eldary, there's a question about, and it was alluded to in the discussion, what is the role of what is the role of fluorescein, and how does fluorescein inform us as compared with OCT?
Yeah.
So it was made into a gold standard that a fluorescein angiogram, if you have any swelling in the optic nerve, it will leak on a fluorescein angiogram. However, this was not really tested very well. So despite having fluorescein for such a long time, nobody has actually done a study whereby we looked at cases whereby you have mild grade 1 to 2 optic nerve head swelling and compared them to pseudopapilledema and really showed that it shows a difference. In Stacy's study, we didn't have the grades of the edema patients, so that's data that's lacking right now. That's why I don't like FA to decide whether it's really, if there is true papilledema or not. And the other way it can be a false positive is that if you have a CMV next to the nerve, it will leak, giving you the impression that there is papilledema, so you go down the pathway of getting an MRI that you don't really need.
Thank you. Okay, for Dr. Phillips and Lou, is there a place for oral steroids in the treatment of optic neuritis, or can you clarify that?
You know, we thought about this if we're going to do a randomized study, but the amount of oral steroid that you would have to give to be the equivalent of a gram of IV methylprednisolone is probably prohibitive. So I don't think it's equivalent. So if you're going to do steroids, I would do IV.
Yeah, I agree. Some of our adult neurologists are treating the adults with a whopping dose and 20 pills and all, but it generally is impractical, and you have to go IV to get the proper dose.
Wonderful, thank you. So for Dr. Gilbert and Dr. Edmond, does age play a role in when you would consider neuroimaging? So age at presentation.
Well, from one standpoint, obviously if they're old enough to not require sedation, it lowers your threshold a little bit because that comes out of the equation.
And one of the studies that both Aubrey and I quoted felt that one of the risk factors was older age.
Yeah, over 6.
Right, over 6. So yeah, I think it does factor into it. Except if they're moderately, highly myopic and you feel like they may have myopia related in that older category of associations with ACE. Patients may have divergence insufficiency, a little bit of abduction deficit, and they're acting like these older patients with divergence insufficiency esotropia that Joe Deemers nicely described.
It was interesting. I tried talking to a bunch of different radiologists to find out what standard protocol was as far as what age, under which, like above what age do they not use sedation. And it varies by country. It turns out there's studies showing that in Germany from age 4 and up, there are publications. I can't believe that. And in the UK from age 5 to 6, but most of the radiologists I talked to at Kaiser said age 8. So
I need to get some parenting advice from the Germans.
Yeah, I think so.
Okay, so that's the end of our session. We appreciate all of your participation, and thank you so much to our esteemed panel. We really appreciate your arguments.